Sucralfate suspension, final dose form, is used to treat ulcers in the intestines. It forms a protective coating over the ulcers, which helps to prevent further injury and promotes faster healing. The daily dosage and optimal timing for taking this medication will depend on the individual's condition and the doctor's instructions. Before taking sucralfate suspension, make sure to shake the bottle well. It's best to take this medicine on an empty stomach, at least 1 hour before a meal, as directed by your doctor, usually 4 times daily. The dosage will depend on your medical condition and how you respond to treatment. Using this medication regularly will help you get the most benefit from it. Try to take it at the same times each day to help you remember. Even if you don't feel ulcer pain, it's important to keep taking this medication, unless your doctor advises otherwise. It may take 4 to 8 weeks for your ulcer to heal completely. Some medications may not work as well if you take them at the same time as sucralfate. Your doctor or pharmacist can help you create a dosing schedule that works with all your medications. You can use antacids with this medicine, but make sure to take them at least 30 minutes before or after sucralfate. If your condition lasts or gets worse after taking sucralfate for 4 weeks, be sure to inform your doctor. Some common side effects of sucralfate suspension include constipation, dry mouth, upset stomach, gas, and nausea. If these side effects persist or worsen, it's important to notify your doctor or pharmacist. It's important to remember that this medication has been prescribed to you because your doctor believes the benefits outweigh the potential side effects. Many people who use this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as persistent feelings of fullness in the stomach, nausea, vomiting, or stomach pain, especially after meals. A serious allergic reaction to this drug is rare, but seek medical help immediately if you notice symptoms such as rash, itching or swelling of the face, tongue, or throat, severe dizziness, or difficulty breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using sucralfate, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that could cause allergic reactions. It is also important to let them know about your medical history, especially if you have kidney problems, stomach/intestine problems, or if you are using tube feeding. If you are planning to have surgery, it's important to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. For older adults, there may be a greater risk of developing high aluminum levels while using sucralfate with other products that contain aluminum, such as antacids. If you are pregnant or breastfeeding, it's crucial to consult your doctor before using sucralfate. It's important to be aware of any potential interactions with other medications that could affect how sucralfate suspension works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription and over-the-counter drugs, as well as herbal products, and share it with your doctor and pharmacist. It's important not to start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with sucralfate suspension include antacids that contain aluminum, certain antibiotics, including quinolones such as ciprofloxacin/levofloxacin/ofloxacin, tetracyclines, digoxin, ketoconazole, levoketoconazole, penicillamine, phenytoin, quinidine, and thyroid medications, such as levothyroxine, liothyronine. Be sure to discuss any concerns with your healthcare provider. If someone has taken too much sucralfate suspension and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help. In the US, you can call 911 or your local poison control center at 1-800-222-1222. In Canada, residents can call a provincial poison control center for assistance. It's important to note that your doctor may suggest some changes to your lifestyle, such as stress-reducing activities, dietary adjustments, and regular exercise, to help with the treatment and prevention of ulcers. Sucralfate suspension should never be injected into your veins, and it's important not to share this medication with others. This medication is typically taken on an empty stomach, at least 1 hour before or 2 hours after meals, usually 4 times a day or as directed by your doctor. Be sure to follow your doctor's instructions carefully for the best results. If you forget to take a dose, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to store sucralfate suspension at room temperature, away from light and moisture. It's important to keep it out of the bathroom and away from children and pets. When it comes to disposing of the medication, don't flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard the product when it's expired or no longer needed, and consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.